Good evening, Xoli. Well, I was out at the Temba Memorial Hospital that's out in Boksburg. If our viewers recall, that is the hospital that had that gas tanker explosion back in 2022. And the significance of that is, of course, that it is one of the 60 hospitals that were meant to benefit from that tender coming out about a year, just under a year after that explosion took place. And the aim of that was, of course, to install these oxygen tanks at the hospitals, but also some other refurbishments that were to take place. So when we went out there, it was still at a similar state that it was at the end of 2022, with that closed bridge still awaiting that demolition and some of the work still to be done at the hospital. And that tender was from, after the permission from the Global Fund, and if we remember, the Global Fund, administered by Bill Gates and the Gates Foundation, pulls together, it's an international financing and partnership organization that pulls together funding from various government organizations and private sector as well in the fight of various diseases within the healthcare system, and to ensure that healthcare services can be improved in countries such as South Africa. But when the Global Fund approved that project for the IDT, the specification there was that it should not exceed 216 million rand. So that report initially starting off as an internal investigation, but the department saying that they came across various loopholes, clearly one of those being just getting the information of how the procurement process actually took place. And Minister Dean Macpherson saying it was the same story for PricewaterhouseCoopers that was then, tasked with the forensic investigation at the beginning of this year. So that investigation having been taking place for the past 6 months. But let's take a listen to one of the hurdles that they came across in this investigation, being around procurement irregularities and the rules around procurement not being followed. Take a listen.
In light thereof, and further to the information provided by Dr. CC, it appears that the requirement in respect of the SAPRA compliance was an important aspect to the entire procurement process of the rollout of the oxygen plants. This criteria should therefore have been included from the establishment of the panel of service providers, and the entire process therefore appears to be irregular. The PSP pre-tender estimated at tender stage was 216 million rand, and at design stage was 253 million rand, as determined by the service provider. The Department of Health was subsequently requested to approve the increased funding for the rollout and implementation of the plant projects to 592 million rand.
Well, of course, that wasn't the only hurdle that was faced, but issues around pricing as well, with prices being fluctuated by 174%. Remember the Global Fund saying the project should be 216 million rand, but the bids that were received, one of the winning bids, actually more than doubled that price, coming in at over 500 million rand. One of the other bidders actually coming in at 2.5 billion rand. Let's hear what Minister Dean Macpherson had to say around those pricing issues that they faced as well.
Price negotiations were not transparent. In one example, as we said, the Department of Health's budget was 216 million rand, but when the IDT issued the RFQ, prices ballooned to over 590 million rand without a single documented approval or value for money assessment being produced. Thirdly, bulking CIDB grading, as we said, is limited to no more than 200 million rand, yet the IDT awarded contracts worth 428 million rand, more than double its allowed threshold. Fourthly, the report found that the CEO of the IDT, Mr. Ntokozo Khumalo, failed to exercise oversight. The report confirms that she relied entirely on internal SCM staff to assure her that the processes had followed proper procurement protocol.
So, Xoli, the report is with the new board at IDT, as well as the minister having spoken to the Minister of Health this afternoon. And I suppose when we do hear from him later on this evening, he will give a little bit more information around the recommendations and how far those recommendations will go in actually putting an end to procurement irregularities within government departments, such as the Department of Public Works and Infrastructure. Xoli.